Right, hi. We have 11 on the line with us on Facebook. Hello, welcome to the Suicide Prevention Talk series. My name is Johnson. I will be your moderator today. I'm a counseling student from University of Malaya and a volunteer from Skybe. Skybe is an online psychologist matching platform. It provides various types of mental health and support services, including individual therapy, marriage and couple therapy, group therapy, and corporate counseling. You may want to check out our website at mindskybe.com to find out more. Oh, just to let you know, we also have an outreach program. You can search from our website as well. So in line with the Suicide Prevention Awareness Month, Skybe organized a suicide prevention talk series to help you understand the importance of suicide prevention. Today is the second topic of the suicide prevention talk series. We are going to talk about mental health care. But if you would like to look at what we have talked about earlier, you may search the video on our Facebook page with the title Suicide Prevention Talk Series, Topic 1, Community Care. And let's not forget that we have the third topic of the talk series, that is grief after loss by suicide on the 11th of September, which is on the next week. So now let's come back to the topics today. Today we are going to talk about mental health care. But what exactly is mental health care? And why is it important in suicide prevention? And how do we actually take care of our mental health? If you have the same questions in your mind, you are at the right place to find out the answer. And of course, if you have other questions that you would like to ask later, you may actually send them in the comment section, Facebook, or you can actually search for the link that we have posted there. That will be that you can post your question with anonymity. For that, I would like to invite our speaker today, Ling, a counseling student from Monash University, Malaysia, and a counseling trainee at Skybe, to share with us what she knows about mental health care. So let's invite our speaker again. Ling, over to you.
Thanks so much, Johnson, for the introduction. Right now, let me try to share my screen here. Yep. And let me start presenting. Okay, so thank you everyone for joining today. So as Johnson mentioned, my name is Ling, and this is part 2 of the Suicide Prevention Talk series. So last week we touched on community care. We talked about how the community play a role in suicide prevention. And one of the things that we mentioned about is risk factors to suicide. And 2 of them are mental health disorders as well as chronic illnesses. So knowing that our health can affect suicide prevention, all the more we need to take care of our own mental health. And today, last week's more on community, so today we're going to talk more on how we as an individual can take care of our health and in turn prevent suicide. So I'm gonna disclaimer here. Again, really thank you guys for joining, but of course we care for your emotional safety. While today's talk is maybe not as heavy as last week, and we're gonna be covering more on general healthcare guidelines rather than as heavy as last time. But understandably, there might be mentions of suicide here and there. And if you feel any triggers or you need to take a step back halfway, if you need emotional assistance, please refer to these hotlines. We listed them in the comment section as well, so feel free to refer to them. And don't worry if you need to step back halfway. This whole thing is recorded and it will be up on the Facebook page for your view later on. So don't worry. Take your time, take a pace, and let's get to it. So today's content, I will be touching on the importance of mental health, as well as 3 steps to mental health care, which are the first one, avoiding toxic positivity, practicing mental health exercises, as well as seeking help. So according to the World Health Organization, health is a state of complete physical, mental, and social well-being, and not just the absence of disease or infirmity. This shows that rather than the major focus on physical health, because usually, oftentimes when we talk about health, we think of the physical aspect, but it also encompasses the mental and the social aspect. Yeah, we need all three in order to take care of ourselves, in order to reach a good well-being, because mental health is an integral part of health. Indeed, there's no health without mental health. So that's according to the World Health Organization. But what about mental health care in the Malaysian context? What about the mental health care system that we have here locally? So I'm going to give a brief introduction on that following this history timeline. Yeah. So in Malaysia, the mental health field is a pretty young field. It started actually in 1890, where we have our first psychiatric hospital in Penang. That was during the British colonial times, in which they had the hospital to treat colonial navy who had mental illnesses. And then slowly after Penang, they started building more psychiatric hospitals in 1910s throughout the peninsula and even in Sabah and Sarawak. They first started up north in Perak, which we have our infamous Tanjung Rambutan, down to Johor, and to our neighboring state. And then in 1958, after Malaysia has their independence, that is when they merged a mental health ward with the Penang General Hospital. This is the first time they are merging mental health services with a non-psychiatric hospital to provide holistic care. This is a huge jump because back then when they had the psychiatric hospitals, the treatment was more custodial. It's more isolating from society, and it also seems prison-like, and they actually had a high mortality rate. And with this merging, you can show that physical and mental health are both valid. You don't need to isolate them from society necessarily. And this gives more holistic care. And then in 2001, another leap, because the Ministry of Health actually established the Mental Health Act. This is quite an achievement because this act meets the criteria that is set by the World Health Organization. Malaysia is recognized internationally now, and the act itself encompasses detailed policy guidelines for the delivery of mental health services in Malaysia. So again, it's a rather young field, but we are still building, and more we're getting more research on mental health and better services here.
Wow, Ling, I didn't know that Malaysia has such a great history in its mental health care ecosystem. I thought like most of the Asian country, we are relatively slower compared to those Western country, if the stereotype that we know. But I didn't know that Malaysia actually has such great history to go through. But in terms of the awareness part, I think a lot of people still don't know what exactly the word mental health care is. Would you like to share with us what it is about?
Yeah, sure. Thanks, Johnson. I'm gonna touch on that on mental health care. And even for me, as I was preparing to talk, I just found wow, we have such history. And you're right. In terms of mental health, in terms of psychology, the science originated earlier in the West, rather so, and kind of glad that it reached here. Yeah. And in terms of mental health in general, how do we envision it? How do we imagine this or define this? Well, for me, remember that health encompasses three parts of well-being. So you can consider health overall first to be like a car, okay? And mental health to be a part of the car, something like that. So when it comes to a car, we have the physical aspect, the body, the windows, everything. And but we also have parts of it, right? We have the engine inside, we have steering wheel, we have the signal lights, we need oil tank for it to keep it running. And when it comes to car maintenance, we actually take care of all parts just so that we can ensure it runs well, it runs smoothly, and ensure that we have a safe drive. And if we are to neglect part of it, if we are to, take care of the physical parts, but then ignore the gas tank, or if we ignore maintaining our brake pad, then that can seriously affect not just performance, but safety as well. So same goes to our health. And we need to take care of our mental health as well as physically. Because both parts of health are actually linked together. So you can see that poor mental health is a risk factor for chronic physical conditions. And when you have serious mental health conditions, you actually have somatic symptoms, which is kind of like unexplained symptoms on the body, like aches, pains that you don't know where it's coming from. And with that, you are also at a high risk of experiencing chronic physical conditions. And if you have chronic physical conditions, you're also at risk of developing poor mental health. So it's a vicious cycle here, and it goes to show that both mental and physical health, they come hand in hand. And the factors contributing to mental health are life experiences, family history, and biological factors, similar to what we covered in the previous talk. And yeah, your mental health can affect many, many areas in your life, such as work, school, home, relationships, sleep, appetite, energy levels, ability to think and make decisions, physical health, and life satisfaction, many more. Yep. And why we take care of mental health? Because when it is positive, when we are able to maintain it well, then it allows people to realize their full potential, cope with the stresses of life, work productively, and make meaningful contributions to their communities. And so remember that in the last talk, when we mentioned that there are thoughts of loneliness, when you face barriers of accessing community or social connections, and when you have thoughts of feeling you're not capable, you're not up to your potential, the combination of these two thoughts can produce suicidal desire. And you can see here with positive mental health, that can help mitigate those thoughts because they're able to realize their full potential and make meaningful contributions to the communities. They have access not just to their own strengths, but with social care as well. Okay. And with that being said, how are we to take care of it? We'll talk about these 3 steps. So the 3 steps are avoiding toxic positivity. I'm going to say it again. Practice mental health exercises and seek help. And the first one, why do I say avoid toxic positivity? Why don't I just jump straight to the mental health practices? This is because positive mental health is often confused with toxic positivity. And what I mean by that is toxic positivity is when someone imposes just positive thinking as the only solution. They demand that the person avoid negative thinking or express negative emotions, and they demand just positivity from people regardless of the challenges. This, don't get me wrong, positivity can be a good thing on its own, but if you only focus on that and ignore or suppress your negative emotions, then that can cause real harm and problems along the way. So Johnson, what do you think about toxic positivity?
Well, when you talk about toxic positivity, right, I can really relate it a lot because generally I'm a kind of person very extroverted, and then I like to play with having social around, and then I like to have fun with all the people around me. And then generally they think that I'm a very my spirit is always up in the sky. But then sometimes I do appreciate some quiet time as well. Sometimes I think about a lot of weird stuff like the universe or the purpose of life, all these kind of topics that will wander in my mind, right? So whenever I go into this kind of deep thoughts, then the friends around me will say, "Hey, are you okay?" All this thing, and then I think the words like "it is okay to be not okay," right? The word itself has uh, been a lot of people is using this, and then they keep on hoping to see some of the high spirit in others. So whenever you are having a relatively lower spirit, then they will use this word to encourage you to, hey, cheer up, things like that. But then in fact, sometimes I just like to be quiet, and sometimes I like to be having fun. So I'm kind of want to tell them that it is okay to be okay, because I'm really okay in the sense that I'm not like saying, hey, saying I'm sad or whatnot, but then people just kind of like want to cheer me up, things like that, but then it's just not the right time. So yeah, I think this relates to me a lot when you talk about toxic positivity. Yeah. What
Yeah.
about you? Do you have any experience like that?
Similar, because like yeah, there was that stereotype in which when people know that you're an extrovert, they think, oh, you must have boundless of energy. Then you must be happy-go-lucky all the times. Nothing must be wrong. Oh, you can handle it. You're strong. But these labels are kind of dismissing the fact that we can be human as well. We have negative emotions, and that's okay. Like, it's totally normal. Like, even if we are most of the time positive and happy, but we have sad times too. Yeah, it's totally relatable. And um, it can also be seen here. So there's examples of toxic positivity. One that you mentioned is to kind of, while well-intentioned, I get that your friends must have good intentions, because maybe they're not used to seeing you being sad as well. But then the notion kind of seems like it doesn't seem okay to feel these negative emotions somehow. So yeah, that's toxic positivity, even though it's quite subtle. And so in toxic positivity, let me name the examples here. So one of it is urging people to thrive no matter what adversity. So a very popular but can be quite harmful notion was, when we're stuck in the first few months or times for lockdown, and it was COVID-19, it was the pandemic, and when we're stuck at home, people think, oh, we have a lot more time on our hands, and with a lot more time, people think, yeah, we got to be productive, we got to use that time well to hustle or to you know be productive to things. But sometimes people have different circumstances, people have different access to resources and all that. And during this pandemic, everyone is facing a collective trauma, right? And so when we're facing collective trauma, it is impossible to expect people to be fully productive, because this is a huge change. This is a huge change to our life, to our routines. There's safety to consider. And a lot of people also lost their livelihood. And so we got to be considerate instead of pushing people to just be positive. And another thing is, after catastrophe, people tend to say, oh, everything happens for a reason. This is a very generalized term, but it doesn't really address the negative things that we experience. It kind of dismisses it. And toxic positivity can also look like urging someone to focus on just the positive aspects, especially after a devastating loss, which is not helpful because it stifles people to express their true emotions. And it is also toxic when people, tell someone to get over their grief and just focus on the good things. That's just not helpful. And if we were to think about suicide, during a suicide crisis, when someone is feeling so overwhelmed, and while again, it comes from good intentions, it is not helpful when you tell them to, just think on the positive side, be grateful for what you have, because ultimately that dismisses the person's pain. And sometimes the person just needed to hear that, yeah, life sucks too, but they're not alone. And why I keep stressing that toxic positivity is bad, because it ignores real harm. So there's a narrative review of 29 domestic violence studies, and they found that positivity bias can actually underestimate the severity of the abuse. So optimism, hope, and forgiveness actually increase the risk of people staying with abusers and being subject to escalating abuse. And toxic positivity also demeans a loss, because when a person is going through a loss and they keep hearing people tell them to get over it or just be happy, it can feel as if people don't care about their loss. It can feel as if whatever they're going through is invalid. And this invalidity feeling can lead to isolation, because they might feel alone in this feeling, or they might even feel ashamed of their feelings, because they might feel like, oh, what's wrong with me? Why can't I feel happy when people keep enforcing all of these messages? And because of that, this stigma can actually deter someone to seek mental health treatment. It can also cause communication issues, because if this sort of positivity message encourage people to ignore any problems or challenges, that can really destroy the relationship as well as the ability to solve any problems, because it's kind of similar to the car analogy, where if you have a broken pad and you're pointing out to your partner, hey, we have a broken pad. And if your partner says, oh no, it's fine, the exterior is okay, just focus on the good part of the car, you're actually enabling risk, because if you have a broken brake pad, you gotta address it, or else if you don't, it will affect the driving performance again, similar to affecting your daily functioning, and it can potentially lead to harm, to risk. Yeah. And when people encourage you to ignore your negative emotions, stifling them can actually come back even more powerful. And when they're unable to feel positive, that can really affect someone's low self-esteem. Yeah, it can get their self-esteem to feel low, because they may feel as though they're failing. It's like, why can't I be happy? So these are the harmful effects of toxic positivity. And we then can look ways to avoid it. Even if we have done some of these, like even though we might have made some of these mistakes in the past, it's okay. It's never too late. Maybe after this talk, you can look through what toxic positivity you have intentionally or unintentionally have done, and we can find ways to address it. So for the self, we can start recognizing that negative emotions is normal and an important part of the human experience. We can try to identify and name these emotions rather than avoiding them. We can talk to trusted people about our emotions, all kinds, good as well as the bad. And we can seek support from non-judgmental people, such as your trusted friends, or if needed, a therapist. As with others, we can perhaps start encouraging people to speak openly about their emotions. We can get them to be more comfortable with the negative emotions. Doesn't have to just be about celebration. We can avoid trying to have a positive response to everything a person says. Again, when someone is sharing with you that maybe they're feeling suicidal, maybe they feel so overwhelmed, it's okay to admit that, yeah, I feel your pain. It is really painful, and or maybe life sucks. Work is hard. Yeah. And with that camaraderie, then they might feel less lonely, and they feel that it's okay to feel this way. And by recognizing the intense negative emotions, we can then also see that it often coincides with powerful positive emotions. So sometimes the intensity of our emotions indicates something deeper in us, a need we have not met, or something that is meaningful to us, such as, in profound grief, when we feel such intense emotions, that's where it might show that, hey, it might mean that this person means a lot to us. This person has contributed a lot in our lives. And it's intense emotions doesn't have to be a bad thing. So,
Yeah, Ling, before you move on, right, I just want to add on another thing to ask your opinion because I come across like whenever I believe not just me, a lot of people, including our audience here, um, I think toxic positivity there is kind of a root, and I believe the root is actually from social media, especially when the celebrities they usually post whatever whenever they make a post or the the people they make any post in social media they post on the positive side of them. They having a vacation, they having good food, they are enjoying life, things like that. We rarely see people say that, hey, I'm sad. Such comment or such picture that share on social media. So that kind of an influence to the general public that they think, hey, positive is the only emotion that is allowed. And personally, I think this is kind of a trend that happening in our society right now, especially when social media is already in our life. We are part of social media life already, so the influence is inevitable. This is my opinion. I don't know what you think.
ooh, that is a valid view, a good view to bring up, because it is true that social media plays a huge role in people's perspective. And um, Instagram, especially Instagram, when it is a platform where we put pretty pictures, that's where, if you just look at the post, you can easily just see the pretty side of things, the highlights. You know, nobody likes to really post the ugly side or admit that these are bad days. There is a trend, yeah. And even if they want to post something like sad or negative, I often see it in stories, Insta stories, where they're just like really short reels, and they're only up for like 24 hours to view. And oftentimes it's either on stories where the negative emotions are just there briefly shown, or they might actually put it under close friends. Yeah, because sometimes it's not really comfortable for them to post about these negative feelings. They didn't know how to feel, and maybe they're worried that people might judge them. So yeah, there is
Yeah,
such toxic trend, but I think slowly, as we are starting to talk about mental health, I did see some celebrities, especially in the West, they actually posted about their struggles. I've seen Demi Lovato actually sharing about her journey, her story through her music. She talked about her past history with eating disorder, with overdose, drug overdose, and it's a small step. Maybe not everyone follows these stars that can be quite vulnerable with their weaknesses, but yeah, while majority is a positive side, I can see there's a glimmer of hope there.
yeah. On the self level, right? From my
Mm.
own experience, actually, whenever I see some of the things that in the past, for example, a T-shirt during the high school time, and then I recall some of the not so happy memory, then I will start to think, hey, how much I have been through. Those are the kind of evidence that I have grown up. I have uh, gone through so many challenges through life. It gives me a sense of achievement that although I have been through tough times, but I somehow able to overcome it, and here I am today. So I think people might need to start embracing the negative side, not always the positive side, I would say.
Yeah, so true, Johnson. Yeah, like, and sometimes when we do take pictures of the bad times, and years later or as time passed, we can also realize these moments are temporary. And if we actually keep them rather than delete them from our memories, we can actually see how much we grow from there. That is so true, Johnson. Thank you for bringing that up. I love it. So
Yeah.
yeah.
Yeah, but I hope I don't bring out your topic too far away. Let's
Oh, no.
continue to your topic. Yeah.
Yes,
Thank
of
you.
course. Thank you. So yeah, that's pretty much on toxic positivity. So why I say this is because we need to first address that it is normal and okay to both have positive and negative emotions. Because if we are to avoid the negative emotions, it's very hard to pinpoint any problems we have, and it will make the rest of the steps redundant. So the next step would be practicing mental health exercises, right? So mental health actually consists of emotional health, cognitive health, and behavioral health. What I mean by those is the ability to feel, the ability to think realistically, as well as the ability to take action. So let's first touch on emotional health and their exercises. So when we are feeling overwhelmed, when we have these feelings that we can't seem to name, or as we feel our muscles tighten, we feel our hearts pumping, oh my gosh, what am I feeling? Let's first take deep breaths. First, we take deep breaths to calm ourselves. It can help reduce the anxiety and alleviate any tension, not just from the mind, but the body as well. And once we take these deep breaths, then we can have a clearer mind and we can try to label our emotions, because being able to identify them helps distance ourselves away from the emotions. It's okay to name the emotions. It's okay to acknowledge that they're there, but it might not be as helpful if we're too overwhelmed by it or we get hooked into it. And so with this, then being able to distance ourselves there, we can gain a better perspective on the emotions as well as the problems that we're dealing with. And once we identify whether it's an emotion we have to deal or a problem we have to deal, that then we can use healthy coping skills. So with uncomfortable emotions, rather than ignore or stifle them or leading to toxic positivity, we can use these coping skills to lessen the focus on the pain and help alleviate them. It is not to suppress, it is not to eliminate, but is to lessen the focus. And then we can then have a better, clearer mind. And yeah, the first one, I can give a short demonstration on how we take deep breaths, because oftentimes we might not know how to breathe correctly especially when we're having like a panic attack or when we're having like anxiety. So maybe Johnson, you'd like to follow my lead?
Yeah, I'd like to do so.
Yeah. So a little break for everyone. Let's just sit back in our chairs, spine straight, but not too rigid, guys. Just make sure you relax. So put your one hand on your chest to your heart. Yeah. And okay, I hope my mic is still here. And another hand on your stomach, just like the picture. Yeah. And so when we breathe in with the count of 4, and then we hold our breath, and then we let go, we exhale through the mouth. So we count the 4 on inhale, count the 4 on holding the breath, and then we count to 8 as we exhale. And when you inhale, it is best to inhale from your diaphragm, from your stomach, rather than your chest, because our chest maybe has a less volume space there, volume area. So it is best to breathe from your stomach. Even experienced singers, experienced course speaking people would breathe from the stomach. Okay, so let's try. Inhale, 2, 3, 4, and hold, 2, 3, 4. 2, 3, 4, 5, 6, 7, 8. And another round. 2, 3, 4. Hold. 2, 3, 4. 2, 3, 4, 5, 6, 7, 8. So breathe 2 again through our stomach. 2, 3, 4. Hold. 2, 3, 4. 2, 3, 4, 5, 6, 7, 8. So that's pretty much it. It's a little hard for me to actually breathe, but I hope you guys are following along. How do you feel, Johnson?
Immediately, I feel the atmosphere seems to be calmed down already, because I think it's a kind of internally, when we are like running for something, we are busy. Things seems to be happening very fast, and then when we practice this breathing exercise, things seems to slow down really immediately. I would say the effect is immediately, and I can feel it, like everything becomes slower. And then, of course, I believe this is relaxation. It's a part of relaxation.
Yeah, it's a part.
Yeah.
It's a part. It's
Yeah.
to help relax, and it's also to give oxygen to our body a little, because like when we get nervous, then our breathing might actually shorten. We might not get enough oxygen there. So this is one way. And yeah, that's taking deep breaths. So next, when we label emotions, oftentimes we might have some trouble there. We might not know where to start. And so often, when you don't know, you can always come to therapy. And with therapists, we can actually use tools like this, which is the feelings wheel. And so this feelings wheel is in which there are circles there in the middle part, in which they name the most basic emotions that we have. And then after that, once we identify which emotion, we can then expand our vocabulary and see which specific sub-emotion that we're really feeling. Because oftentimes, when people aren't able to identify, maybe because it's too overwhelming, or maybe it's because we don't have a rich vocabulary. Maybe ours is quite limited when it comes to naming our emotions. So being able to read up more on our feelings can really help us identify what we truly feel. Okay. And sometimes when we're working with kids, you can also try using the feelings thermometer, because this is a fun way to introduce psychoeducation to the kids, as well as showing that, what are they really feeling at this moment. Yeah. And once we're able to identify what emotion we're facing, or maybe what problem we're facing, then that's where we know which coping skills are more appropriate. So we have first, that is emotion focused coping skills. We can try exercise, taking a bath, giving yourself a pep talk, or meditate. But then if it's more problem focused, then maybe we can touch on time management, maybe asking for support, establishing healthy boundaries, and creating a to-do list. Right. And so that's emotional health. We talked about avoiding toxic positivity, to recognize both the good, the bad, the negative, the positive emotions. Then once we're able to identify, we're able to take deep breaths, label them, and come up with the right coping skills. Then we can move on to our cognitive health, our ability to think, our beliefs, and how we view the world and ourselves. So for the cognitive exercises, we can start by trying to talk to ourselves like a trusted friend. So oftentimes when we are aware of ourselves, because we're the ones best knowing of what goes in our minds, what we look like overall. So that can really be overwhelming sometimes, but also we can easily see our flaws. Yeah, we can see actually better than other people. And so when we see our flaws a lot more than other people, then there might be a tendency in which we view ourselves more negatively than positively. But then in contrast, it seems easier to show a friend that we love, a friend that we care, some compassion when they're suffering. This is because we love and care for them. And so if we are able to extend such affection for others, why not try to show the same for ourselves? I know it's harder than what is said sometimes, because it could be years and years of unlearning you need to do, especially when in the past you might have faced any trauma. You might have faced criticism from other people, and that can really put down on your self-esteem. But then it's never too late. You can still try and try again and show yourself the compassion that you really need. Okay. And when we start treating ourselves like a best friend, like someone we care for, that's when it comes to difficult times, we can try to argue the opposite. So what I mean by argue the opposite, I don't mean toxic positivity. I don't mean to say, let's ignore the bad side, yeah, and just focus on the positive. I don't mean that. It is good if we are able to acknowledge the negative moments, but in those moments that you think everything will go wrong, you can think of things that can go right. We can start focusing on things that are within our control, what we can change and do for the time being, and acknowledge that maybe some things is really out of our control, and that we still can do the best that we can, so that to make things better, to alleviate that pain. Yeah. And yeah, Johnson?
Oh yeah, I do have a question here, Lee, because what you suggested here, more of like a cognitive exercise, what we are going to tell ourselves to think positively or to count. We all know that, I believe, including our audience, we all know that having to counter the negative thought with a more positive one is good for us. But then sometimes, especially when we are in a difficult situation, we just don't have the motivation to do so. And especially when I think of some of my friends who generally have a lower self-confidence, they will always say, hey, I cannot do it. Whenever you suggest anything that, hey, you should think positively, things like that, they just can't get it. They just can't do it. For cases like this, what do you suggest?
Okay, so understandably, in low moments, even ourselves, when we are feeling less motivated, and it's very hard to see light at the end of the tunnel. So again, we can start with calming ourselves, trying to distance ourselves from the emotions first. But then after that, maybe once we have a clear mind, once we're not stuck in that quicksand of depressing thoughts, then that's where we can list out the pros and cons. Oftentimes when we buy something or when we want to do something, we tend to evaluate the pros and cons, right? So same thing goes. We can acknowledge that there are bad times. We are facing bad times right now. What you're feeling is valid. It is totally okay. But also, don't forget there are good moments. You can start thinking, what are the good moments there? And this is where it can be quite difficult when you're feeling overwhelmed. So it's good to be able to seek help during those times, or find any coping skills you can come up with. But then when you are feeling stable in everyday life, you can train your sort of like your compassion muscle. Okay, like it is actually trainable. Like your sense of gratitude, positive feelings. So in order to train those muscles better, we can try writing in a gratitude journal. So with the gratitude journal, it can help activate and strengthen any positive feelings. Yeah, you can try writing 3 things down that you're grateful for. You don't have to do it every day, because just like exercise, it is good to do it in a minimal. Otherwise, you get desensitized, or you're getting used to it. So it's good to do it occasionally, 1 to 3 times a week. You can try writing down those 3 things. And the things that you're grateful for doesn't have to be positive events. It can also be negative events. Yeah, because in hindsight, we are able to see what we can learn from these negative events. And when you write down these 3 things, you can try to be as specific, personal, and detailed as possible. Because when it is quite general, then it might not mean as much. But then if you're able to pinpoint the very things that you're grateful for, then that can be easier to remember, and it's more meaningful. And once you're able to note these down, you can try to note down surprises that happen throughout your life, and you can savor these surprises, and you can see the good things as gifts. Even in the bad times, you can see it. What can you learn from this experience? Yeah, like what is it that you learn and what is it that you can do better in the future? Yeah, it's just because it's a negative emotion, it doesn't mean it's a doomsday. It's not it's like something that you can't fix, but well, maybe some things you can't control, some things you can't take back, but you're still here and you can still learn from it. All right. And yeah, that's pretty much on the cognitive exercises. So far, we covered on emotional and cognitive, and now let's talk about more on behavioral, because in the previous one, it's more towards the mindset, it's more on your emotions, but let's talk about action. Let's talk about what we can actually do. And so with behavioral exercises, in order to take care of our mental health, we can try practice healthy habits. So what the healthy habits are self-care activities that can help improve or maintain your sleep, appetite, mood, and health. We can also schedule positive activities. Life doesn't always have to be about health, 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 health. It can also be joyful things. Helps you re-energize, yeah? Like a warm bath, a nice meal, like or taking care of your sleep hygiene, etc., etc. Anything that brings you joy. And not only that, you can also engage in hobbies, because hobbies can engage your mind, and you can also bring sense of accomplishment after you learn something new or you do something that you can accomplish. And understandably, everyone is different. Yeah, just because we have some guidelines for health, it doesn't mean it's a one size fit all. Depending on your circumstances, depending on your resources, your access to help, all these things into consideration, you are free to experiment and see which of these habits and activities suit you best. So speaking of all this, Johnson, what would be your favorite self-care activity?
For me, like I say just now, I'm an active kind of person generally. So exercise is definitely something for my for me. So compared to like the cognitive exercise and the emotive one, behavioral seems to be the things for me lah. Especially for swimming, I like to do swimming a lot because whenever I'm under the water, I feel relaxed. So I think that is my very personal way of having to recharge myself whenever I have a long day or whatnot. So yeah, swimming is my best way. What about you, Ling?
Swimming. Oh, that's a good one. And I miss it, especially now that we're stuck in the middle of COVID and we're not able to access the swimming pool. I really miss that. But yeah, if it's not swimming, for me, right now, what I do is mostly taking care of my sleep. Yeah, I try, although I tend to be a night owl, but I do try to get as much sleep as I can, as well as trying to make time and space for things I like to do, such as like mobile games or reading, because like as we're doing our studies and all, like it is also important to carve out some time for yourself. Otherwise, you'll feel overwhelmed or burnt out, which is something I really get scared sometimes. But hey, we're all managing, and yeah, everyone is different.
And
yeah.
I can actually suggest you something because recently I also pick up this hobby. Can I say hobby? Not yet a hobby lah, because it's very new. As well as suggesting to our audience, 17 of us here. Recently I started to plant onion. You see, those onion that we buy from market, we can actually plant them on the egg tray. The egg tray that when we buy the 30 eggs, that kind of tray that is made of cardboard, you can actually stack up them and then buy some soil, and then you put the onion there, it will grow. That feeling when you see the result when it is starting to grow and you see the greenish kind of thing in your room or in your house. That kind of feeling is really good. But it's a very new kind of activities that I engage myself in. But not only this alone, but I just want to bring out that sometimes you can do something that we have never done before. It kind of gives us a feeling of surprise ourselves, and then engaging ourselves into something new. That kind of feeling is very good. I can experience from my own. So I hope that this could help you or our audience here to get a new experience during you can do it to even like lockdown period. Yeah.
Oh gosh, this is a new one to me because I love onions, and to actually be able to plant it in such a cost-saving way, it's like there's that sense of achievement that you mentioned, but it saves us financially. And not only that, there's more onions. Thanks for the tip, Johnson. Oh my gosh, that's a new one to me. Okay.
Yes,
So
you should try.
Okay, maybe after this. Okay, I'm coming back. So as we talk about behavioral action and we talk about practicing healthy habits, we got to first define here what is self-care. We got to clarify what's self-care, all right? Because oftentimes when people think of self-care, they think of spa treatments, they think of all those luxurious stuff. But in actuality, what is self-care is in choosing behaviors that balance the effects of both emotional and physical stressors. So self-care is not just the nice things, but it's also the nitty-gritty things in which you have to work on so that you can maintain your health, your overall well-being in the long term rather than short term. So sometimes it is maybe even going to exercise when you don't feel like it. Sometimes it is to save up and eat healthy because we have to do it within our means so that we can survive in the long run. And what self-care is not self-pampering. So there's nothing wrong with pampering yourself. Again, as I mentioned before, it is okay to do some joyful activities for yourself, but so long as you're able to afford them. Because if you were to blow your money on self-pampering, but then don't have enough left for self-care, then that can really affect you and your resources, and you might not be able to manage well. And yeah, that's not self-care, that's self-pampering if you were to overspend. And if you are to overspend, that's also self-indulgence. Self-care is actually not self-indulgence, because self-indulgence avoids any effortful solutions by substituting quick and easy antidotes, such as drinking alcohol, taking drugs, binge eating, or binge watching Netflix. While those are joyful in the short term, but then if you were to rely on those to stifle any negative emotions, that can really affect your health, your overall well-being in the long term. Okay, so self-care is both the positive as well as the negative. And yeah, talking about self-care, we can actually cover on a number of practices that we can do to maintain our health. And one of it is sleep. So sleep hygiene is really important. It is important to take care of the environment that we're in so that we can have fruitful sleep. Because if we're not able to go into deep sleep, then it's very hard to recuperate and have enough energy for the following day. And in order to maintain that, we can try establishing a routine. We can create a healthy sleep environment, like turning off our lights, or make sure that we sleep comfortably. We can turn off our electronics an hour before bed, avoid food so that our stomachs can have rest, reduce stress, exercise, and limit caffeine. That's one of the ways. Not only sleep, we also have to watch our diet, because our gut health actually affects our mental health. So how it is because our gut and our brain are in two-way communication. They actually, the microbiome in the gut actually creates neurotransmitters to regulate brain activity. It can help calm anxiety and boost your mood. And if we are to feed it with unhealthy food, if we do not take care, and if we eat more junk food and less greens or whole unprocessed food, then it can actually cause imbalance in the gut, and that is linked to anxiety, depression, and other mood disorders. And how we can improve our gut health is by eating fermented foods such as kimchi, or sauerkraut. Yogurt also helps. They contain beneficial bacteria. So the next time if you order from any Korean restaurant, feel free to stock up as much kimchi as you can. You can try to eat prebiotic foods like asparagus, garlic, dandelion greens. I checked it on Google. It seems like to be some sort of tea, but in Asia, we're more familiar with, let's say, spinach or kale. So you can try those instead. You can try to eat a range of whole unprocessed foods so that your bacteria has a whole diversity. And then not only just foods, we can also try to curb our stress levels with deep breathing, like what we did earlier, and meditation, so that we're less likely to binge eat, okay? And again, just like Johnson mentioned, exercise, it's not just for the outdoorsy people, but it is key to our health in general. It can improve mood, it can improve sleep, increase focus, helps long-term and short-term memory. It can reduce stress and anxiety and help us overcome depression. And if we do it at least 3 times a week, keep our body moving, and at least for 30 minutes a day, then it counts as something. It's the little increments to the investment of our health. Yeah. And if you feel like you don't have the time or you're not able to, you can also try the high intensity interval training, because that one, it can be as short as 10 minutes or 5, like just little bits to keep your body moving. That can really help with your mental health. And overall, we have talked about our emotions. We have talked about maintaining our thoughts, our beliefs, how we view. We can also talk about social self-care. We've talked about taking care of ourselves, but we also got to take care of our own relationships, because sometimes if we're going through a tough period or if we're busy, understandably, it's very hard to reach out to people. And know that it is okay to be anxious if you haven't reached out to that friend in a while. We might feel kind of like worried and scared. Oh no, what if that friend thinks I ditched them? What if they don't miss me? I wonder if they miss me too. That's okay. These are really valid worries, but you can take the first step. It's okay to reach out, even if it feels uncomfortable, because in the end, your intention is to connect with them. Your intention is to take care of these relationships. And if you reach out more, then you might give yourself a higher chance of them reaching back and be able to reignite anything that was lost before. Okay. And so with social self-care, it involves having fun with people we love. Also, it involves the nitty-gritty again by talking effectively through conflict and addressing the emotional needs of the people we love as well as ourselves. Okay. And with all said and done, again, I will remind you again and again, you are allowed to love the things that bring you joy. You are allowed to paint whichever, even if it's not artist worthy, or everything doesn't have to be some form of productivity. Okay. If you love drawing, do it. If you love taking pictures, if you love playing games, so long as it brings you joy and it brings you meaning in life, just do it. It's okay. And yeah, that's all of what we can do for mental health exercises.
Yes, Li, thank you for sharing so many exercises that can help us. Indeed, a lot of exercise, including the behavioral exercise, it helps me a lot. But I do come across some of my friends. They seems like none of the exercise that we have talked about works for them. For example, we have suggested them hey, go out for exercise. Yes, they will go, but then those exercise doesn't seems like works for them. Whatever things that he or she do just doesn't work. So in cases like this, what do you suggest?
Okay, yeah. Thanks for bringing that up, Johnson. And true, sometimes, even if either other people or they themselves have come across that, exercise is the way, or eating healthy is the way, and such. But then sometimes it can be kind of difficult to try, or maybe they have tried. They have tried all of these that I've suggested, but it doesn't seem to work, right? And when we consult with friends, with family, they can help, but also to a certain extent sometimes. And that's when, if it feels like all of these doesn't seem to work, I would suggest to seek help. So far we've covered all of these already. But ultimately, if it really doesn't seem to work, or you're facing trouble with your daily functioning, I really highly suggest to seek professional help. So one of the early warning signs that we can look out for to know that, okay, maybe it's time to seek help. Perhaps it's eating or sleeping too much or too little. Maybe it's pulling away from people and our usual activities. Maybe it's having low or no energy. Maybe it's feeling numb, or somatic symptoms like unexplained aches and pains. Maybe it's feeling helpless or hopeless. Or maybe you notice that you're smoking, drinking, or using drugs more than usual. So if all these things happen more than 2 weeks, and if more so, if you're feeling unusually confused, forgetful, or edgy, or angry, or worried, or sad, if you feel like you've been yelling and fighting with friends and family a lot more than usual, or experience severe mood swings, have persistent thoughts and memories you can't seem to get out of head, if you even to the point of hearing voices or believing things that are not true, or thinking of harming yourself, or have the inability to perform daily tasks, if you experience these for like consistently more than 2 weeks, I suppose that can be a sign that you should probably seek help. Because, as much as we try to cope on our own, sometimes it can be helpful if we can get a better perspective, or another alternate perspective, especially from someone who's trained in this. And the following professional help that we can turn to are psychiatrists, clinical psychologists, or a counselor. And I'm going to break it down because a lot of people oftentimes aren't sure who to turn to when it comes to their mental health issues. So I'm going to talk about psychiatrists. So they're actually a medical doctor, and they specialize in psychiatry. They are qualified to assess as well as diagnose both mental and physical disorder. And they're the ones who are qualified to prescribe drugs to treat any mental disorders that you have. And besides that, for clinical psychologists, they hold a master's or doctoral degree in clinical psychology. They are qualified to give you a diagnosis and assess for these mental disorders. They can conduct psychotherapy as well, just like talk therapy, but they do not prescribe drugs. That's up to the psychiatrist. But these two can give a diagnosis for mental health disorders if you feel like these issues are disrupting your daily functioning. And the third one, which is a counselor. So counselors are considered kind of like the first front line in terms of mental health, because as you can see, we hold a master's or doctoral degree in counseling, and we are qualified to conduct career as well as personal assessments for all ages, whether it be adults or teenagers. We conduct counseling, and the issues that we help out with are more of non-disordered issues, just as career issues, maybe relationship or communication issues. Maybe you have issues with stress or time management. All of these things that can be manageable and can be explored, see like what kind of coping skills that you can try out or practice. And yeah, for counselors, we actually do not prescribe drugs and we do not diagnose mental disorders. But if we suspect that you might have something that is needing medical attention, we would refer you to a clinical psychologist or a psychiatrist when needed. Yeah. And so these are the three mental health professionals, depending on the issues that you have. If it's non-disordered, you can see a counselor. And if you need a diagnosis, you can try clinical psychologist first. And if you need further assessment and medication, that's when you see a psychiatrist. And so far, that's the end of the talk. So what we've covered so far is the first one, the importance of mental health, how our Malaysian mental health care system came about, and why mental health is important, and how it is like a car, maintaining a car. And because health is comprised of many parts, just like the car. And then we also talk about the 3 steps to mental health care, which is to avoid toxic positivity, to secondly practice those mental health exercises. Yeah. And then after that, once you've tried it all, but then it doesn't seem to work and you needed further assistance, that's where you can seek help. That's pretty much the end of my talk here. I am open to questions now.
All right, thank you, Ling, for presenting such an insightful talk to us. Today is kind of more relaxing talk, and I think you have already addressed all the questions that we have earlier, including what is mental health care, why is it important in suicide prevention, and also how do we take care of our mental health. So I hope our audience would remember the 3 important steps, that is to take care of our mental health. The first one is to avoid toxic positivity. Second one is practice mental exercise. And the third one is to seek for help. Now let's see if we have more questions from our audience. We will actually look into the comment section if you have any questions regarding today's topic that you want to ask. I also look into the Slido's link that if you would like to remain anonymous, that will actually capture some of the questions there. But before that, I just hope that those audience in online right now, you can actually help us share this link, this live session. If you find that it's helpful for you and you want to help your friends to know more about mental health care, you can help us to share this to a friend. And looking forward, we have some discussion, continue to ask Ling about mental health topic. So the first question here we have is rather, well, I think it's a little bit related to the previous talk. Seems like suicide cases are increasing after COVID-19. How can we bring out the importance of mental health to the society? So Ling, what do you think?
Okay, so yeah, just like how we mentioned in the previous talk, like there is an increase of suicide cases after COVID-19. And how do we bring out the importance? Well, there are actually many ways to address mental health. And one of it, of course, is awareness. But how do we bring out awareness? It is also can be integrated in our everyday practice, such as like with toxic positivity, if we were to curb that, then it is great if we are able to start practicing allowing people to express more of their emotions, like not just encouraging them to talk about the good things, but we can also try to practice holding space for people and talk about the negative things. We can try to practice giving them the safe spaces and telling them that, you know, it's okay to not be okay. It's okay if you're feeling suicidal or you're feeling overwhelmed, because these are normal human reactions. And though they are overwhelming now and might need further help, but it is okay, because depending on the circumstance, depending on their access to help, they might need more support. And so the first step we can do is encourage people to talk more, to express more authentically of themselves. And again, it refers back in the first talk one of the myths in which like people are worried that if we were to talk about suicide, will it encourage people to actually go do it? And again, it's a myth for a reason, because oftentimes people don't know who to turn to talk about suicide. And so by actually allowing people to talk about it and open space for them, then that's where we can get the conversation going. We can raise more awareness, and we can then even share resources such as this talk, or many other posts, or as well as referrals and services that are available to explore more on mental health.
Right. Indeed, there's a lot of way to do so. And but whenever we have some idea to help them, remember we want to avoid toxic positivity. Yeah. But let's look into the second question we have here. The feeling wheel is interesting. Same goes to my. I also think that the feeling wheel is interesting because sometimes we just can't find the right words to express ourselves, and yeah, it actually helps us to process our inner feeling. But this person, he say he come across thermometer rater as well. Is it the same function? What do you think, Lee?
Thermometer rater. If it's similar to the picture earlier in which that there is kind of like different numbers and different ratings to the range of emotions that you feel, I suppose that's similar, but I could be wrong, because so far I've only come across feelings. It's called feelings thermometer, but maybe there is something similar. Maybe they're the same thing, just under a different name, but I could be wrong. So I'm just going to clarify that. Maybe I'll Google, or maybe you can Google about it as well. But ultimately, the feelings thermometer is just a simple analogy to psychoeducate more on identifying our feelings. Yeah, it's more of a tool, but not necessarily like a one-shot cure or anything, right? It's just to help build our vocabulary and to integrate it easier to our everyday life, because a thermometer is a relatable thing somewhat. Yeah.
Yeah, and I also look for that there is actually a lot more tools, a lot more English website that help us to find out the words that we can express ourselves. But if you prefer a Chinese word, if let's say you are Chinese speaking at home, you can look for the right vocabulary to help you to express your feeling to others. That it will be really great to actually help us open up to others, let us know how do we feel. Right. We just came in a third question. By going through therapy or medication, is mental health can fully be cured? If yes, would it be relapse after that, or relapse after we stop the medication or therapy?
Okay. When it comes to medication wise, I will disclaim that because I'm just a counselor trainee, so I have maybe more knowledge in terms of non-disordered issues other than medication. But fully cured, I understand that there's a kind of like, imagine it's kind of like a flu or a cough. Sometimes I can't guarantee that you'll be fully cured, but then it is good if you're able to follow the doctor's prescription or to take note of any side effects that you have, because mental health issues come from a wide range of factors, and it is good to be able to specify and note our circumstances before coming to a medication or a diagnosis. And even for medications, from my understanding, it might take time or experimentation before you can find the right dosage. And so will it be fully cured? There's possibility for recovery, but I wouldn't say fully, and depending on the mental illnesses that you have. And it is possible to relapse, because it takes time to explore our own beliefs. It takes time to implement or establish new habits, because we might fall back to old ones because it feels safe. Sometimes all these old habits, even though we know that it's not good for the long run, but understandably, it is something we're familiar with, and that's okay. But then, by acknowledging that, we're doing the best we can, it's okay to relapse. It's okay to get back up after that, and then we can try again, so that we can find the ways that is helpful for us. If people were to stop medication, yes, it is possible as well to relapse, but that's okay. Sometimes I understand some people would like to ease off on the medication, but again, it depends on how well you're able to cope without the medication. Some people, maybe they find that I think I am all right. Maybe I can try to lessen on the medication. You can try. You can express that with your doctor. But again, it is best to follow the doctor's advice because they're trained in it. Yeah. So it's best to refer to a professional on this, right?
Right, thank you, Lee, for answering this. I think, yeah, like Ling said, this is more suitable if, let's say, you have your doctor, your physicians to help you on that, especially when just now Ling already explained the differences between psychiatrists, the clinical psychologists, and counselor. So, yeah, I guess if, let's say, you have a psychiatrist that prescribe you the medication, it is best to actually refer back to him or her to get the best advice. All right. Thank you very much. And we are still open for questions. If you have more questions regarding today's topic, mental health care, and please feel free to come drop in your questions. You can drop in the comment section, or you can drop in Slido that is shown in the screen right now. Okay, before we have more questions from the audience, I myself have some questions for you, Lee.
Okay, hit me.
Yeah, I do come across some cases, right? We know what is best for them, but then whenever we push them, we feel like am I doing toxic positivity kind of thing? Just like we have discussed about. But then what do they do? Is actually sitting there binge watching, binge eating, and then their routine is just they go to work, right? Like right now they work on online, and then after online they just lie on the bed doing nothing. If let's say we have such kind of situation, or one of our friends or family members doing this kind of routine, right? How do we? What should we do? Should we push them? Should we ask them, hey, you should get up and do some exercise or whatnot? Should we push them, or should we let them be? What do you think?
Okay, that is a good question, and it's, I think it's pretty common as well. Like when people, they wanted to help the person, they can clearly see the problem, but maybe the person isn't motivated enough, or maybe they might be thinking they don't need help, And so first we gotta come back and think to ourselves, what are our intentions when trying to help this person? Because ultimately, when we see someone that we care about, when we see them, like it's clearly that they're not functioning as well, or they change a lot from before. But then how do we help them? So your intention was to help because you care for them. And from there, perhaps we can start with approaching them gently and opening up the conversation a bit, rather than pointing out all the flaws that they have, or give them judgmental comments. We can first approach them and kind of like, if they're open to us, then perhaps we can kind of gently bring up, hey, like I noticed that you've been sleeping a lot more, or I noticed that you seem quite down, or any changes that you notice. And you can mention that because of these changes, you're quite concerned. Yeah, ultimately, you care for them. And it is by opening up that we can gauge whether they want to, they're open to talking about it, or they have something on their mind but they weren't sure who to talk to. And so by providing them that safe, open space, then maybe they might feel more likely to talk about their problems and explore. And once we are able to name any problem, then rather than telling them what to do, it is best to kind of give them suggestions, kind of like, I know this counselor, or if you're tight on money, I know this free counseling service I come across. By suggesting to them some resources, then it gives them the autonomy to choose whether or not this can help them. And we can also ask them, what can I do? How can I help you alleviate this pain or what you're going through? By asking them open-ended questions and checking in with them what they need, then it gives them more autonomy. It gives them more choice in choosing what they need, and it can also kind of empower them, letting them know that they do have a choice and they know what's best for themselves. But then if they seem closed up or they're not willing to address it yet, then it's okay. You can still try to care for them, such as providing them food or taking care of any chores that they need help with. But understand that it is best to let them choose rather than push them or give them unsolicited advice, unless they are harming themselves. Yeah, again, just like we mentioned in the previous talk, if they are harming themselves or they are harming others, and if it's an emergency, that's where you might need to keep them to stay there, as well as calling the necessary help, like either an ambulance or the fire department. Okay, yeah.
All right, thank you. That is a very practical way to help them, right? Yes, thank you for answering my question, because I do have a lot of question marks in my mind whenever I see things like this. So yeah, I think that's all for today. Today's topic is kind of a relaxing one. It's more chill, and I hope everyone can actually learn something from today's talk from Lee. And I guess that's all. If there's no more, yes, there's no more question. I guess we can end for today. Again, thank you very much, Lee, for sharing your thoughts about mental health care with us. We appreciate your feedback, and we do have this feedback form, and we would like you to help us to give us some feedback. See how can we share you more information that can help you in future, and then also appreciate your feedback on us. How do you think we can do better to convey this information to you that help you and your family members, the close one, your friends, to actually have a better mental health, mental well-being. All right.
Yeah.
So I think that's all for today. Thank you again, Lee, and thank you for our audience who are listening to us. And our next talk will be Grief After Loss by Suicide. That it will be happening on the 11th of September. I'll see you there. Bye.
Next Saturday. Bye, guys.
somebody that I don't know, but you're taking shots at me like it's Patron, and I'm just like, damn. It's 7 a.m. Say it in the street, that's a knockout, but you say it in a tweet, that's a cop out, and I'm just like, hey, are you okay? And I ain't trying to mess with your self-expression, but I've learned a lesson that stressing and obsessing about somebody else is no fun. And snakes and stones never broke my bones, so you need to calm down. You're being too loud, and I'm just like, you need to just stop. Like, can you just not step on my gown? You need to calm down. You are somebody that we don't know, but you're coming at my friends like a missile. Why are you mad when you could be good? You could be sunshine on the street at the parade, but you would rather be in the dark age, just making bad songs. Must have taken all night. You just need to take several seats and then try to restore the peace and control your urges to scream about all the people you hate. 'Cause shade never made anybody less gay, so you need to calm down. You're being too loud, and I'm just like, you need to just stop. But can you just not step on his gown? You need to calm down. And we see you over there on the internet, comparing all the girls who are killing it. But we figured you out, we all know now. We all got crowns, you need to calm down. You need to calm down. You're being too loud, and I'm just like, you need to just stop. But can you just not step on our gowns? You need to calm down.